My name is John Kilkin. I'm a physician here with Franciscan Health. I work in the neuroscience department. I am an anesthesia-trained pain management doctor. We're here today to talk about treatments for lumbar spinal stenosis. This is a very common problem in the population, and there are new technologies available, one of which today I'd like to talk about is called the Vertiflex procedure. The Vertiflex procedure is really designed for people who have a hard time standing and walking. Lumbar spinal stenosis is a condition in which the nerves of the low back are pinched and can create back and leg pain. The Vertiflex procedure helps alleviate some of that pinching of the nerves in the low back. There are many treatments for lumbar spinal stenosis, and we usually try to use conservative treatments first. So patients oftentimes will have tried physical therapy or some medications like anti-inflammatory medicines or nerve pain medicines. If these just aren't sufficient, a lot of times we'll try interventions like maybe a steroid injection or something like that. If that still doesn't work, that's when we consider some of these advanced procedures like implanting the Vertiflex. The Vertiflex procedure is an outpatient surgical procedure that is performed under general anesthesia. The whole procedure takes about 30 minutes. The Vertiflex procedure is performed in an operating room. There's an incision that's about 1 inch made in the spine at the affected levels. Through that incision, there are a series of dilators and guide wires that help us insert the device in the appropriate position. There's a few steps that you can see here that are going on. There's a spacer device that helps us put the appropriate size device into each individual person. Once the size is selected, we can then insert that through our cannula and deploy the device between the spinous processes. Once we confirm that it's in the correct location, the cannula is removed and the device is left in place. Then it's just a matter of suturing the skin together and the procedure's done. After the procedure, patients are sent home to recover. There may be a couple days of soreness. We do ask patients to avoid bending, lifting, and twisting for about a month afterwards. Most of the time, patients will find relief fairly quickly after the procedure. A lot of times, if folks haven't been walking very much ahead of time, they can be pretty deconditioned. Usually about a month after the procedure, we'll have patients go back to physical therapy to work on rehabilitation and reconditioning themselves to walk again. If you're a person who struggles with back and leg pain, and particularly with walking and mobility, and you'd like to learn more, please visit franciscanhealth.org.